presentation. I've worked a lot with Rob in the past on trying to fill some gaps, but we're really revving up our training program. So I'm really glad to be here with all of you today, and hopefully, something will resonate. But I was really excited when I heard that one of the goals is, to train staff to respond to mental health crises and to come up with action plans and those sorts of issues, since that's really what I try to focus on. I'm going to be ambitious and share two different documents today. One is our menu, we call it, of trainings that are sort of already exist, evidence-based trainings, a lot of them. Some of them have been created by me and others with doing research. But the thing I really want to drive home is the fact that we pride ourselves on attending to the specific needs of the community, of the agency, of whoever it is that's asking for the training. For example, I just did COVID-19 specific trainings for seniors, for the Conkling Center, for frontline healthcare workers dealing with burnout, compassion fatigue, vicarious trauma. I'll do the research, I'll get the resources together, so that the organization doesn't have to do it, and then put it into, hopefully, what is a cogent training that fills a need alongside the evidence-based trainings that I've been certified to do. So I take a lot of pride in that work, and really welcome any questions, suggestions, conversations moving forward. And like Rob said, I would love to be a part of the group as you move forward to fill these gaps. Hopefully I can help from my corner here. So what I can start with is maybe just a short little overview of a training I would give to communities, staff of different agencies, really anyone, which we start with Mental Health and Wellness 101, kind of where are we coming from as a community, how are we approaching the subject of mental health and wellness, what is our attitude toward it? And then from there, we sort of build upon that, see where the gaps are. Oh, we need more help here, we need more help there, or I never thought about it that way. Our agency or our organization could really use some more work. We feel traumatized, or we're feeling burnt out. I've noticed staff burnout. Things like that tend to kind of come in after, and then we can fill in those gaps, and people are able to serve their clients, their patients, etc. better. So I would love to start with our mental health and wellness. I will share my screen here. And this is actually from a training through the Mental Health Association of New York State, which we have an affiliate partnership with. So we work with a lot of other agencies in order to fill these gaps and get these trainings out to the community. So I would start, we all have mental health. And do you agree or disagree? And you don't have to answer. Usually I would ask for an answer, but we're in the virtual COVID world, so people would generally respond. Most people agree, some don't know. So I see the thumbs up. So what I'd like to point out about this is that there's a spectrum here of well to unwell, with no sort of break in the middle. Sort of the old antiquated, archaic way of looking at mental health was through a disease lens, right? There was mentally ill people, and then there was not mentally ill people. I don't look at it like that. That's not sort of the wave of the future, how we look at it anymore. We look at it as we all have mental health. We're all on the spectrum of wellness, and we could be toward the right on well. Maybe we have genetic predisposition, environmental factors, all working together, nature, nurture, whatever it might be, to create unwellness. And then at another point, we could be doing very well. We have supportive families, supportive people in our lives. Maybe it's a time of year when someone's doing well, or over on the left side. We can fall anywhere along the spectrum of mental health and wellness. So that's really kind of, it might seem pretty simple, but it's a different way of approaching mental health. When we're all sort of along the same spectrum, we're all in this. It's not us and them for anybody. And I think that's a really important way that I approach my trainings and just everything I do in terms of the work that we do. And also, just a way of looking at things too, we have a wellness model that's a multidimensional model. As opposed to looking at everything in a vacuum about a person, we have the whole person at the center of our model, which I think is really important since we're really person first, focusing on whole person wellness. And what affects this whole person wellness? Mental health is part of that. But we have a lot of contributing factors and variables. We have physical health here, healthy habits, lifestyle choices, what's our diet like, what are our sleeping habits, those classically physical things affecting our whole person wellness. And then we have here the emotional aspect, what is someone's resiliency like? There are innate differences in resiliency, but that can be built upon. And coping strategies, do people have the proper coping strategies to deal with issues that might arise in their life? Or is that something that might be lacking that needs to be built upon? That contributes. We have our social dimension. What are our relationships like? Are they positive? Are they supportive relationships? And that too is going to work dynamically to affect the whole person. And then we have down here our sort of not the classic way of looking at whole person wellness, but really important, an intellectual dimension. Does someone feel challenged? Do they feel like they're in a growth mindset as opposed to a fixed mindset? Do they feel like they have an opportunity to grow, to express themselves? How do we nurture that in people? That will contribute. And we have over here our spiritual wellness. Do people feel that there is a purpose to their life? It doesn't have to be religious necessarily, it can be, but do people feel that there is a greater purpose to their life, that there's meaning that's beyond what they might see in the moment, especially during a time of struggle? And then occupational, do people feel that they are using their talents, they're using their knowledge and skills, that they are contributing to society, contributing to their own health and wellness by possibly working, volunteering, and a lot of that goes on at Eastside Center where I work, trying to build up that aspect along with all these other ones. But the real thing to take away is that we have the whole person at the center and all of these different dimensions that are contributing to a whole person's wellness. And then, of course, there is no health without mental health. The World Health Organization tells us health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. So sort of thinking about that spectrum, it's not either or, it's not black and white. Again, just another way of really looking at it. But mental health is important to our overall health as an individual. And then, something else that we really like to point out in a lot of these trainings is that this is not a hidden, well, it might be hidden, but this is an issue that exists in a large way. It's very prevalent in our society. So we'll look at prevalence rates. In the past year, it'll say 18% of people, this is American adults, have an anxiety disorder. Approximately 7% have major depressive disorder. Approximately 8% have a substance use disorder. And then if you look at that last point, approximately 1 in 3 people with a substance use disorder also have a co-occurring mental health disorder. And usually I'll ask people, I'll say, what do you think of these numbers? Do you think they're high? Do you think they're low? Do you think that it's correct? And most people will say, oh, it seems high, or I didn't, or maybe that's low. And I'll say, yes, it's probably low, right? These are just the numbers that we have that are documented. And this is something that's out there in our communities. People are struggling, and a lot of times there is fear of getting help. And a lot of that relates to education and destigmatization, which is something that I really try to home in on. And then we talk about substance use disorders and mental health co-occurring or comorbidity, people using substances as negative coping strategies for when they're struggling, to kind of drive home the point that those occur together. And it's something to really take a look at as to why that might be happening. Misinformation and fear of stigma make them difficult to identify mental health disorders. There's normal human responses that might be difficult to differentiate. Is this something that I'm just going through? I do talk a lot to younger people, adolescents, students. Are there typical changes? And then also people get used to their symptoms until there is a crisis. So maybe they have been getting more unwell and more unwell, and then finally something else happens and they just can't ignore it anymore or can't manage it, without getting some other kind of help. And then some people just don't know, right? And we're kind of talking about that today. I was listening, and some people just don't have the knowledge. We need to learn and be educated and kind of let ourselves be the people that can make a difference in terms of mental health. So I have risk factors for mental health problems and protective factors. So this is sort of an overview of a training that I might give, mixed with, and I won't go through all of this, but I have a helping the helpers trainer also for staff, because what a lot of times ends up happening is we focus a lot on who we're working for, our clients, our patients, who we're serving, and our staff ends up feeling sort of like this lady right here. So I do a training on vicarious trauma, compassion fatigue, burnout, which I kind of call helping the helpers. And we go through that. What is it? It's sort of like a little teaser trailer. What is vicarious trauma? We'll talk about it. Experiencing trauma through other stories. We'll talk about what compassion fatigue is. I'm sort of feeling like I'm really tired and I've cared so much, the cost of caring. I really like this quote: the expectation that we can be immersed in suffering and not be touched by it, for caregivers especially, this is relevant, is as unrealistic as expecting to be able to walk through water without getting wet. So we're all, especially in a caregiver role, people are affected. And sometimes it's what coping strategies are we using in order to deal with some of the things that we're coming across, that we're seeing, and the emotions that we're feeling. And then we have burnout, which kind of is the most severe of the three. That's when the stress is chronic and people are physically, emotionally exhausted. They become cynical, maybe even detach. They feel ineffective. And then I kind of give an overview of what they might look like in real life with some quotes. So I want to make sure I have time here. And then I really like to focus on self-care, letting people know that they need to take time for themselves in order to be okay to help who they're helping. So I don't just focus on, what do we do in a crisis? That's something I'll talk about in a second. Or how do we handle this sort of crisis? Or what's the best number to call, et cetera. That's all in these trainings. But also, how do we stay okay so that we can do the such important work that we are doing? So there we go. That's my contact information. And what I will show you, I'll actually stop sharing and reshare here in a second. is this sort of training menu. Um, so we do have our mental health first aid, which we provide in person or virtually. And this, I think, is really an important one because I noticed we were talking about how do we respond to crises. This gives an action plan. And what's great about this training is that you can be anyone working in any situation. You don't even have to be someone that works for a specific agency that would deal with people in the human services. This is for anyone. This is kind of like the CPR of mental health. How do we help somebody until we maybe need to get them to more of an appropriate professional? But it's really effective, really informative. It's a longer training, and there are different variations of it for emerging adults, elderly people, veterans, people who work in public safety. And then we have the Mental Health and Wellness 101, which I gave a few slides from there in the beginning. Again, it can be tailored to fit your time constraints, just increasing that basic knowledge of mental health, trying to reduce some of that stigma. It's a great place to start for people that are like, we need to have this mental health discussion and then see where to go from there. And a lot of times we'll start with mental health and wellness and move on to, we need more mental health first aid, or there's a lot of trauma. We need to learn about trauma. And we have a training that really touches on how to be trauma sensitive to the people that we're working with. We talk about the adverse childhood experiences study. And this is a really great training that a lot of people enjoy. Helping the helpers. Again, I've sort of touched on that. Compassion, fatigue, burnout, vicarious trauma. I do offer bridges out of poverty. Just give a quick one. And then school-centered trainings. We have trauma-sensitive schools. It's very similar to the other trauma training, except focuses on people who work in the school environment. And then this training through the American Foundation for Suicide Prevention is for teen depression. I've gone into classrooms and given these trainings directly to students. Then we also have Talk Saves Lives, which is a suicide prevention training. It's 1 hour and really gives people that sort of, again, first aid suicide prevention skill set. Also through Mental Health Association of New York State, I've been trained to give suicide safety for teachers, which I have done in a variety of schools. This is kind of what to do when our students are in trouble. Instead of having that moment of panic, it's a Friday and a student says something troubling. How do I handle this? What does our entire school system have in place in order to handle it? It's a systems approach. We're going to use the entire school system to make sure that we know what to do. And then I've done this program Lifelines in a few schools. It really takes a lot of buy-in from schools, but it's a suicide prevention program that targets the entire community. We talk directly to the students, we talk to the parents, we talk to the staff and administration. And that's really a prevention. I hate to say our trainings are reactive because we can be reactive, and I can do reactive trainings, but I really like to do prevention and more upstream training so that, maybe we can prevent some of these things from happening, some of these crises from moving to another level that they might not have if we had the proper training. And the thing I really want to drive home is that any needs not addressed by the following list can be fulfilled and tailored to each community entity. And I really urge people to contact me. Even if it seems outlandish, I take a lot of pride in finding information or finding the right other person. If it's not me or someone in our agency, I will help. And I have built a lot of COVID specific trainings lately to do them virtually. I want to help, and moving forward, I'm sure that the needs will change and I will adjust accordingly. So I would love to take any questions. I know it's a lot of information at once, but I do get very excited about this topic, especially when there's a lot of people that I can talk to. So
everything today directly comes from feedback that our other all the people in Long-Term Care Council gave us as to this barrier. So we now know that Josh and the Warren Washington Association for Mental Health are providing trainings and even willing to put together trainings and all of those types of things. And Josh, again, has invited everyone and anyone who has any questions or any ideas or just needs help with something to reach out to him as far as training. And then that led to, at some point, some of these trainings do have a cost. And again, as I keep saying, we're all being asked to do more with less. And so are there funding sources, or how would you find funding sources? How would you get funding to provide these types of trainings to better equip your staff, your organization for mental health crises and provide a more supportive mental health program within your long-term care program? And for mental health, as we've also already said, mental health and long-term care hopefully will begin to forge some new relationships so that it can come around a person and provide a holistic, full person approach to their care and their needs. So Sara is the ARHN manager for the Adirondack Health Institute. And Sara went and found a little bit of money to provide an upcoming free training to strengthen grant funder research, relationship building efforts, and ultimately grant application success. And so I'm going to hand everything over here to Sara about what she and this training are going to be able to provide everyone. And again, all this information is going to be on the minutes and we will share that, but I'm just really excited about this. So this would be a way, to get some money to be able to strengthen your services, ultimately better serve our community. Thanks, Sara.
Hi, so for those of you who don't know me, I am Sara Deukmejian. I am the Adirondack Rural Health Network Manager for AHI. The Adirondack Rural Health Network basically covers anything and everything under the prevention agenda. And so the New York State prevention agenda is such a range that you've probably seen things come out from us. The Healthy Food Guide we just recently did in June, which is a whole food process and farmers markets and CSAs that you can access. We've done work with LGBTQ health and wellness. I feel like that's all the stuff I've been doing right now. And we just recently last week completed the North Country Leadership Summit. AHI and FDRHPO did that as a joint collaboration. So we really cover everything, but one of the biggest things that ARHN works on is access to grants and improving funding in our region. And so when Cynthia reached out and said, we're looking to find some of these trainings, my first thought was I need money to put the training on. And luckily we did run into some funds, so that was great. But basically we do grant trainings as much as possible because that is our goal. And what we found, I want to say, every time I think pre-COVID, it's like a blur, but I believe it was 2019. We did a survey of the 5 years prior of grant writing trainings, grant anything trainings that we did, and found that from the trainings themselves and the grants that people then put in and applied for, we were able to bring a little over $3 million into our region. The Adirondack Rural Health Network region covers Clinton, Essex, Franklin, Fulton, Hamilton, Warren, and Washington, but $3 million, fantastic. So anytime somebody asks me for grants, I'll do my best to get you a training. And so if you've done a grant training with us before, you would have probably seen Diane Leonard. And luckily we were able to grab her again. She's a fantastic resource. And so DH Leonard Consulting, it's her and her team. They work on helping us help you. So we do have a training. It is set for November 5th at 11 a.m. I wish I had a flyer for you yet. I was in summit mode up until Monday afternoon, even though it ended on Friday. So the flyer will, as soon as I have it available, it will go to Cynthia, and I will make sure I include the date and the time in the notes and as much information I can provide for the notes. And I will also, I wrote down the newsletter, Cynthia, and I will make sure to get you guys information for that. But basically, Cynthia, we needed a training to fill that gap, helping people find that mental health funding. And so the training we're working on is really going to have a chance for you to connect with Diane one-on-one, well, in a group session, but she's going to be open to one-on-one conversations, and basically review how we can get those grants. What are we looking for? Are there specific things we should be writing in to kind of secure that funding? So that type of access, it's going to give you tools and strategies. And so I hope everyone attends that. The goal is to have it kind of push towards, like I said, more of a mental health focus instead of just grants in general. Some other things you would see, and I can also send to Cynthia, which may be helpful. We just finished in June or July. Again, I feel like life is a blur, but we just finished a grant training modules series. I can send the link for that. It has 20 different sessions in total across 5 modules. That basically kind of goes over similar tools and strategies, but across a more broad spectrum. And then at the end, if this is something that you need certification for, we do have a certificate available if you complete those modules. We also have I got to think of what these are called, a ARHN Research Funding Opportunities website. It's on the AHI website, and it just links all of the local, national, regional funders that we are aware of, that a lot of our partners and you guys have probably even applied for funding through them. So all of that is listed in there, easy access. We try to keep it as clean cut and easy to access for everyone. So I'll include all of that to Cynthia, but for this training and specifically to this topic of mental health, I'm really hoping that this training will give everyone kind of the ultimate tips and tricks to getting those grants if you need that funding. Like Cynthia said, we ran into money, and I feel like that's always what happens when you're grant funded. You're hoping for funds and maybe you run into it and maybe you don't. And so that's why the websites are always there for free. We try to always make our trainings free so that when we do have money, it's going towards offering the education and not, requiring funds from partners who also don't have the funds. So this training will be November 5th, 11 a.m. We will make sure it is as much related to exact topics people are asking for. If you have specific needs or wants, please send them to me or send them to Cynthia, if you don't mind, and she can send them to me, and I will make sure that the trainer gets them. And then we will be having a pretty open Q&A portion so that you can kind of dig into that more one-on-one approach. Because I feel like sometimes with virtual, you're seeing a face, you may not see other things. Like I said, I don't have anything up today. It's not done yet, but this gives you kind of a chance to have that conversation that we're missing from that in-person piece. So I'm hoping that we hear from a lot of you, and I hope to see a lot of you on. And as soon as we have it, I will send it to Cynthia. Cynthia, do you have anything you want to add to that?
I don't think so. Does anybody have any questions for Sara? And again, all the information will be forwarded.
Yeah,